First dental visit. We are often hesitant to do new things, but there is always something special about the first experience, and only the good ones become the mementos. Don't you think every child deserves one such memory at the dental office? A pleasant first dental experience is a launchpad to a positive dental attitude, particularly in a child. Ayush was a 5-year-old, lively and fun loving kid. One evening, he was in distress and complained of a severe toothache. His mother was worried about taking him to a dentist as she thought he was too young to accept a dental examination. Do you think this situation could have been avoided if Ayush had visited a dentist while he was younger, just like he had been visiting his pediatrician? Yes, it would make his first dental appointment a cordial experience rather than stressful emergency care. It is obvious the first step to the dentist in pain causes more anxiety in the child compared to a routine dental checkup. So, when was Ayush ideally supposed to meet his dentist? I'm sure you are wondering, what would a dentist do to a 1-year old who has just begun teething? The answer is the dentist evaluates the infant's oral health, determines the child's risk for developing dental disease, intercepts the potential problems, and educates parents in the prevention of dental disease in their child. Dentists have a history of following the concept of see and treat. They have only been treating people who report to them with specific problems. But in present times, dentistry has evolved beyond that, with the increasing knowledge about dental caries and the importance of primary teeth. Therefore, it is recommended that the first dental visit be early and a dental home be established for primary dental care of the child. Did you know the dental home is the ongoing relationship between the dentist and the patient, inclusive of all aspects of oral health care delivery? Do watch our video on dental home to understand the concept better. Hey, before we dive deeper into this topic, let me remind you to like the video and subscribe to our channel. Moving on, who is the authorized person to make this decision for the child? It is the parents. Behavior patterns in children are influenced by the environment at home. They mimic and learn whatever they see around them from parents, siblings, or peers. The possible causes for disruptive dental behavior. Behavior contagion, threatening the child with the dentist as a punishment. When intentioned but improper preparation of the child. Discussing dentistry within hearing of the child. Children's anxieties, generated both externally and internally. Behavior contagion was a term used by Walking in 1963 to describe the cause of anxiety in children. Ayush's mother recognized that her lack of knowledge had led to missing early dental appointments for him. She was determined not to let her younger child, Shakshi, who was just teething at 8 months, experience the same situation. Although she missed the recommended initial visit, she scheduled his first dental checkup with Sakshi. She conveyed her primary concern over the phone as Ayush was experiencing pain. The doctor prescribed pain relieving medications to alleviate his discomfort. Additionally, they received pre appointment guidance via email. The pre appointment email, sent by the clinic to prepare both the child and parent, ensured a smooth first visit. It instructed parents to manage their child's expectations by highlighting the brief and positive nature of the visit, avoid instilling negativity by discouraging them from passing on personal anxieties, and finally, explain the procedure by outlining the planned examination. The email put Ayush's mother at ease, and she proceeded to the clinic the next morning. Before the clinical examination, videos of the different dental instruments and procedures were shown to Ayush and his mother, which helped them get familiarized with the treatment method. This step is called pre-appointment modeling, which is recommended by many authors as a method to reduce the apprehension in children visiting dental clinics for the first time. Let's briefly discuss pre-appointment modeling. This behavior modification technique allows young patients to learn about the dental experience, either by viewing other children receiving treatment live or by using a specialized instrument called an audio-visual aid. Live models such as parents, friends, siblings, or other children can initiate an interest in the child for getting a checkup and reduce their anxiety about the unknown procedure. Older siblings of the same gender are often proven to be the best role models for children. However, the disadvantage of live models is that the model itself may show some disruptive behavior, resulting in a negative impact on the child. Thus, models should be selected carefully. With this, the pre appointment preparation for Ayush was now complete. Now, let's get into the details of Ayush's first dental visit. Usually, the first visit is an introductory icebreaker, acquainting the child with the dentist and the practice. The clinic scheduled a short appointment early in the day. Ayush's mother ensured that he was well rested after a good night's sleep. On arrival, he received a warm greeting at the front desk. The assistants took Ayush to the play area, and a buffer period of around 10 minutes was given so he could get comfortable with the surroundings. As it was his first visit, a routine check was done for diagnosis and a treatment plan was set up. Invasive and stressful procedures were avoided. A gradual exposure to dental procedures and techniques was planned to desensitize him to dental treatment. Ayush's mother watched him from the glass window and saw him comfortably interacting with the dentist. After the checkup, the treatment plan was explained to the mother, and the chief complaint was resolved. At the end of the visit, Ayush received a toothbrush with his favorite cartoon as a reward for his good behavior, encouraging him to maintain it in future appointments. Sakshi's dental visit was different from Ayush's. It focused on integrating regular checkups into her routine to prevent dental issues and educate her parents about oral health. The initial step involved completing a questionnaire to gather essential information. The questionnaire covered various aspects, such as biographic data, family, and social history, prenatal, natal, and neonatal history, developmental milestones, medical history, and dental history, including dental trauma, teething difficulties, and oral care practices at home. It also inquired about feeding habits like breast or bottle feeding, use of pacifiers, and weaning practices. Following this, an interview and counseling session were conducted to address any specific concerns she had regarding her infant. The third step involved was examining the infant. Unlike Ayush, Sakshi was examined on regular chairs in a pleasant environment away from the operatory to create a casual and non-threatening setting. The mother's assistance was essential. She and the dentist sat facing each other in a knee-to-knee position, with the child's head cradled on the dentist's lap. Her mother gently held Sakshi to keep her calm and close, while the dentist conducted a gentle but detailed extraoral and intraoral examination. Next, the positioning and technique for tooth cleaning was demonstrated. Sakshi's mother was asked to replicate the position by placing the child's head in her lap. These observations were then combined with previous information to assess risks and make recommendations. Finally, a recall appointment for Sakshi was set for 6 months or earlier if necessary. Additionally, a comprehensive treatment plan was devised for Ayush, including scheduled appointments and regular counseling sessions. Let's understand the characteristics of recall appointments. They should be personalized rather than set at a traditional 6-month interval. During the recall visit, in addition to the clinical examination, the practitioner evaluates the parent's tooth cleaning practices, assesses feeding habits and snacking patterns, and reviews previous preventive measures taught. Now let's summarize the dental procedures recommended during the first dental visit. Feel free to take a screenshot. A routine dental checkup is conducted. If necessary, diagnostic radiographs are taken to aid in treatment planning and introduce the child to dental procedures. Detailed counseling of the parent is carried out, including a brief history of the child's health. Parents are allowed to express their concerns, which must be addressed, and reassured about the treatment outcomes. Emphasis is placed on the importance of good hygiene through brushing. The child's dietary practices are documented. The necessary treatment and its expected outcomes are explained to the parent. The number of appointments needed and the treatment costs are thoroughly explained. Only simple procedures such as oral prophylaxis or fluoride application are performed during the first visit. Additionally, any emergencies such as pain must be addressed promptly. According to a retrospective study conducted in India, a significant percentage of children have their first dental visit between the ages of 6 to 12 years, with only a small percentage visiting by age 3. The most predominant reason for the first dental visit was dental caries. Pop quiz. Early introduction to dental office has its benefits. It establishes a positive attitude towards dentistry, provides early risk assessment and oral examination, prevents diseases through counseling on diet, feeding practices, tooth cleaning, and fluoride assessment, and reduces dental treatment costs. Hope you had fun learning with us. Thank you so much for watching. Don't forget to like the video and subscribe to our channel.